Hello and welcome to the latest episode of the Amplify podcast, brought to you by AIM Youth Mental Health. My name is Nahira.
And my name is Sophie Chang, and we are both AIM Youth Ambassadors. We're so excited to be interviewing Dr. Nia West-Bey, the Executive Director of the National Collaborative for Transformative Youth Policy. Welcome, Dr. West-Bey. Thank you so much for being here. Could you please start by introducing yourself?
Sure. Thank you all so much for having me. I am Nia West-Bey. I use she, her pronouns. I am the founder and executive director of the National Collaborative for Transformative Youth Policy, also known as the TIP Collaborative. This is actually the second nonprofit I've started. I'll talk a little bit more about that as we go. But the TIP Collaborative is focused on achieving transformational policy change with young people and community, and we have a number of areas of focus, including youth mental health.
Okay, you've spent years shaping youth mental health policy at a national level. What first drew you to your work, and was there a moment that made it personal for you?
Thanks so much for that question. So years ago, I think probably back in maybe 2016, I was in a convening where they asked exactly that question. It was focused on mental health, and they asked everybody in the room to share what made it personal to them. And I honestly don't think I really thought about it before that moment where that question was asked. But the first thing that came to mind was that when I was in my first year of college and I was living in a quad, and one of my quad mates actually had a bipolar break during our first semester, which was really scary to watch because, again, we're just getting to know each other. This is our first experience as adults. And what we didn't realize was initially manic behavior, and then she crashed and didn't get out of bed for 6 weeks. And ultimately was sort of taken out of the dorm by campus security. It was really terrifying and made me realize that you really are treated as an adult in that setting. There wasn't sort of very much support offered to us. And it was really interesting because I then had a conversation with my mother, who had gone to college in the 1969 was her first year of college, had a very similar experience where ultimately her roommate died by suicide in her first semester of college. And she had to deal with that with the college. And so there's definitely these sort of close experiences, especially around the transition to college, with folks having their first experiences of serious mental health challenges, which is a really common thing. But I actually hesitated to start with that example because I wouldn't say it's what brought me to the work. And it does feed into a narrative that I think is actually not really well aligned with how most young people think about these things, about serious mental illness, diagnoses, all these types of things that are not really the core. So what truly brought me to the work when I was initially at the Center for Law and Social Policy, or CLASP, was that I was hired to a team that was mostly focused on youth economic justice. We had a network called Communities Collaborating to Reconnect Youth that worked with young people who had maybe disengaged from school and work to try and reconnect them to education and work pathways. And what we heard consistently from the folks leading those communities was that mental health challenges is a real barrier to young people being able to engage in school and work. Like unresolved trauma, all those types of things are what are making it difficult for them to be able to hold down a job, be able to finish school, all those kinds of things. So it was really from that feedback that we got from community partners that we truly launched the work and started to think about what youth mental health policy should look like, centered in the experience of young people with some of the most marginalized identities.
Thank you so much for that response. So after your time as class director of youth policy, what's the biggest lesson that you've learned from young people or youth themselves?
Yeah, and I started to allude to that in my answer to my first question. The biggest thing that I learned, because we started the work by doing focus groups with young people all around the country. So the first one was in 2016, and then we did several more in 2017 and 2018. And the biggest thing that came through was that the way young people were thinking about mental health was quite different than the way that most older people were thinking about mental health. And there was like a big generational difference in how young people were thinking about it. And it really wasn't in a clinical model. It really wasn't in these sort of traditional abnormal psychology types of ways of thinking about mental health, but it was much more focused on who we're trying to become, what are the strengths we want to develop, how do we be good people, how do we show up in the world? And it was striking because it was so not aligned with the way that most mental health policy is set up, to be sure, and with the way most adults, most psychology classes, like most places were talking about mental health at the time. And so that has definitely stayed with me in terms of this more positive view, this more universal view, this more everybody has mental health kind of view, and we're all trying to achieve well-being. That was the most powerful thing that I think that I've carried forward from that time.
That's amazing. It's really cool to see someone talk about the generational shift in mental health, because I think that's really important. From your perspective, what is the biggest gap in youth mental health right now?
I think at this point, I want to say there's not enough listening to young people. And by that, I don't mean not having the conversations, but 10 years into the space, I'm kind of like, how many times are we going to ask young people the same question before we just do what they say? We had a partner that released a report. They're based in California, and they released a report, I don't know, I think maybe in January, where they had spoken to young people about what their mental health needs were, what were the challenges, all that kind of stuff. There were literally quotes in there that were almost verbatim the same things I heard from young people back in 2016. And while it was both affirming to have somebody else pretty much get the same results as I got, it was also really frustrating, because I'm like, we're a decade later and young people are saying the exact same things as they were saying 10 years ago. It's unacceptable. And yeah, I've been saying for several years now, and trying to like nudge people in the policy space away from needs assessment and conversations and like that kind of thing, because I'm like, young people have said what the things are. Where is the political will to do them? And so that is the related problem. I think when young people talk about their mental health, they identify big systemic challenges, which are hard to deal with. And there's just a real lack of political will to address the root causes of the mental health challenges that young people experience.
Yeah, I completely agree with that. And I really do think that there's a big difference between listening and like holding these conversations and then like actually implementing suggestions or youth voices and actually giving young people a space to create real change, rather than just like asking for their opinion and then like 10 years later kind of stating the same thing that they said. So you mentioned larger systems. Like, what would it take at the individual level, maybe the like smaller community level, to like kind of close the gap between young people having their voices maybe shared but not actually heard?
Yeah, I think it's a few things. One, I will say, is that narrative change is really important, and shifting our policymakers to be more in line with the way that young people think about mental health. Mental health is really considered a bipartisan issue, and for obvious reasons, right? Everybody has mental health, but a lot of the policymakers at the national level that care deeply about mental health is from this serious mental illness perspective. Like, somebody in their family has had some kind of serious mental health challenge, and that's what makes them passionate about the work. And that is needed work, and it's important work, but is nowhere near the majority. It's not even, like a significant plurality of what young people are going through. And so moving folks from that place where they care about mental health because of their personal experience to understanding what are the real solutions is just going to require a lot of continuing to talk in different ways about mental health to help move the needle on that. And then the other thing I'll say, I have a colleague in the space who likes to say, if you can't change the people, change the people. And I think that's one of the most important things at the individual level, is using for young people to use their political power to get us some different people if we can't get the ones that are there to do what we need done.
Yeah, I think that's really cool. I definitely do think that, as you had stated, politics can play a big role in that. And since younger people are so passionate about mental health, maybe it's time to see who else that works in those areas can help them out with that. So that's really cool. If you could change one thing about one federal policy tomorrow to improve youth mental health, what would it be?
Okay, so I'm going to say something that's really policy nerdy here, but stay with me. Okay, so I would say one of the core themes that has come through since the beginning of the work is the ways that, again, this clinical model, a focus on diagnosis and treatment in medical settings, is a huge barrier for young people getting the types of support that they need. So again, going back to fairly early in our work, we've been trying to think about imagining ways that young people can get access to mental health care, can get it paid for through health insurance, through Medicaid, those kinds of things, but not have to have a diagnosis first. So The policy change that I would like to make, this is probably the most publicly I've ever said this, is that there is a program within Medicaid called EPSDT. It stands for Early Periodic Diagnostic Screening and Treatment. And that is a special program that currently goes up to age 21 that allows young people to get a lot of types of preventative health care. And the change that I want is I would like the age for EPSDT to go up to 26. Okay, so why is that, right? First of all, a lot of our other policies have actually moved towards a world where we're understanding that young adulthood extends up to age 26. And so cutting young people off from services at 18 or 21 is not helpful, right? So it brings it in line with some other policies. But the most important thing is that now a couple of states, California is one of them and Colorado is another one, have been able to use EPSDT as a way to get young people access to mental health services without having to have a diagnosis. And in fact, to center access to mental health care around certain life experiences. So it's sort of like you've been in the foster care system, you've been in the juvenile justice system, you've had a parent that's been deported, you've witnessed violence in your community, like those kinds of things that are the major sources of trauma for young people. That is what qualifies you for mental health care, as opposed to having to say you have bipolar disorder or depression or anxiety or like these types of things. It's a whole different shift, but that's much more aligned with, again, what most young people's experiences are. Like they're not worried about, oh, I have depression, I have anxiety. It's like, you know, I saw my best friend get shot and I am carrying that with me and that is not resolved. And so it's a small, like policy wonky thing, extend EPSDT up to age 26, but it opens the door to really changing the way that young people are able to access mental health care that is much more aligned with the way that they think about it, the way that they talk about it, and removes this barrier that diagnosis sometimes presents to treatment.
Yeah, and you talked about the different sources of trauma that might cause a young person to seek out mental health care, mental health help. How do you synthesize the research and the data into policies or programs that would actually work for them and cater to, I guess, the trauma experience?
Yeah, I think the biggest thing is, again, leaning into young people's perspectives, whether it's doing focus groups and those types of things, or thinking about youth participatory action research, where young people are the researchers coming up with the questions, doing the analysis, sharing out the findings, because young people know what they need. Like they might know, like not necessarily know to say extend EPSDT to age 26, right? But like they know sort of fundamentally what works and what doesn't work, and what's hard when they're trying to get support and services. And so the best way, I think, to make sure that services are culturally appropriate, culturally aligned, culturally responsive, is to make sure that you are engaging the young people who are going to access the care in the process. And then I think the second piece of it, to the tune of you have to listen, be prepared to hear something that is not necessarily what you thought you were going to hear. I've yet to hear the young person anywhere in the country be like, please more medication, or like, please more psychiatrists, right? It's maybe I need to get out in nature, or maybe I want to engage in art, or maybe I want to participate in protest, or all these other modalities that they find to be supportive of their mental health. And I think that was also a really important realization that I had. The first nonprofit I started did sort of youth development programming for young people impacted by the child welfare system. And we thought of ourselves as an after-school program, right? Not so much a mental health intervention. But again, one of the biggest things that I heard from young people is that they want to get support in places that they already trust, where they already feel connected, where the people, they can relate to the people that are working with them, and from peers that have been through similar experiences. And I realized, oh, we were doing mental health work, even though we weren't calling it mental health work. So yeah, I think it's really important to focus on peers. It's really important to focus on people with shared experience. And there's a set of professions that are aligned with those things. And it's really important to let young people lead the research, lead the questions, and provide the responses.
It's amazing. I believe you went over really briefly about culturally responsiveness. How do you ensure that youth mental health initiatives are culturally responsive and they truly affect the communities that they serve?
Yeah, there are some cool examples in different parts of the country of sort of getting insurance to pay for things that young people find helpful, or for certain cultural practices, particularly for Indigenous communities through Indian Health Services. Sometimes you can get insurance to pay for things like sweat lodges or different ceremonies that young people in those communities find to be beneficial. There are lots of cool programs around the country leaning into arts and the sort of therapeutic value of art, and different types of arts for different communities, right? If you're in a Pacific Islander community, that's going to look different than if you're in an African American community in the South, and if you're in a, Latino community from Central America, or like what have you. But the theme across all of that is that there's curative power in culture and arts and things like visual art and dance, and connecting to your identity and your heritage. And so it's just essential that we make space for all of those things as part of the solutions that are available to young people.
Speaking of solutions, how have newly emerged technological developments, I don't know, I was thinking like AI when I was forming this question, but how do they help break down barriers to youth mental health care access, especially for underserved communities, maybe like accessibility wise? And where do you see both promise and risk in the introduction of these technological developments?
This is a super timely question. So I sit on an advisory group for an organization called Circle Health that has a youth mental health tracker. And I've gotten to advise the survey instrument for the data collection that they have done. And so they do like a big survey every year or so, but then they did a couple of smaller surveys. And one of them this year was on AI use and mental health. And initially, I was pretty skeptical about the topic. I was like, I haven't heard any young person say that this is an important issue. Why are we asking about this? But I'm glad they didn't listen to me on that particular thing, because there were some really interesting findings exactly in line with what you said, right? That particularly for young people with low incomes, for some communities of color that are having trouble accessing traditional mental health services, they're really leaning into AI as a way to get mental health support. And that actually continues a trend that is pre-AI. Pretty early in our work, and especially with the start of the pandemic and the expansion of telehealth during the pandemic for mental health care, young people were saying, please, text and app-based mental health response. And a lot of other countries had done a lot more in that space in terms of people being able to get support via apps, via chat, that kind of thing. And similarly, when we were doing our focus groups early on with social media, there's all this noise and all this energy that's sort of like, oh, social media is ruining young people's mental health, right? And we really tried to push back on that narrative, because particularly for young people from some of the most marginalized communities, social media was where they were finding community, where if you're like in an isolated rural community where there's no other trans people, you find your people online, or, it was a way to connect with your culture. Like maybe you're going online to learn cultural dances from your community, or building community through gaming. So AI is sort of just the latest iteration of something that young people have been saying for years now, is that like technology can be helpful here. So blanket bans and those kinds of things are really pretty on. What did also come out of the research that this group did, that is, it goes to the risk and to the caution. Using sort of general AI chatbots that were not designed to support mental health can actually be pretty dangerous, right? So many young people are using things like ChatGPT or what have you to get mental health support because they don't know where else to turn, because they can't afford care, because they're worried about stigma from their families, or any number of reasons. But the problem is those platforms were not built to support mental health. They were built to keep you on the platform, right? And that has actually had some really dire consequences for some young people who have tried to get support via these chatbots and ended up having sort of suicidal ideation reinforced, or like being discouraged from talking to adults about it, or other things that these general chatbots do. So I think there's a lot of potential for AI to be helpful in supporting young people's mental health, particularly if it directs folks to resources, to real people, to qualified help. And I think AI-driven technology that is specifically developed for the purpose of supporting young people's mental health, I think has the potential to be a really good solution. But we have to have some caution about these generalized tools that were not developed for that purpose.
I think that was a very good question, because our generation definitely uses the use of much. And I know my peers around me, a lot of them are like, yeah, I'll just use it for like therapy. It's fine. But you definitely had a great point about it not being built for that. And I would love to see some AI tools that would be built for mental health. What excites you the most about the next generation of youth mental health?
Yeah, I say this all the time. When I was your age, I did not know that my job was a job. And by that, I mean, yes, I knew people were executive directors of organizations, but specifically this work in policy, I did not know that was a thing. If you had asked me when I was in high school, I grew up in Connecticut, what is a piece of legislation before the Connecticut state legislature, I would have just looked at you. I had no idea. And what I think is amazing about this generation is how much you know and how soon you know it. And that is a really powerful tool. I think when I was younger, sometimes I would experience things or sort of have a sense that something wasn't quite right, but I didn't have the vocabulary to name what was going on and to be able to address it effectively. I use the example all the time. I didn't know the term microaggression. I didn't know the term systemic racism. I didn't, so I would be experiencing these things. And now looking back, I could be like, oh my God, that was a microaggression. But at the time, it was just sort of this vague discomfort and not really having the vocabulary, the tools, the words to name what was happening and how it was impacting me and how it was impacting my peers. So I think it is really, really exciting that y'all know the things that you know at the age that you know it, and really understand at a really young age that you can have an impact on policy even before you can vote, even before these traditional markers of civic engagement, and that anybody can have a voice in policy. I think historically there's been so much gatekeeping and intentionally making people feel like that wasn't their space or like you couldn't be in there. And I feel like today's young people are maybe finally going to get us somewhere because you all have a much earlier start.
Well, thank you so much. To kind of wrap things up, one last question. If you could leave young people with one message about how they can make a difference in mental health in their communities, what would it be?
Yeah, and I think so it can look different for everybody, but my advice is just find your lane and lean in. Maybe your lane is that you want to get mental health first aid trained, or maybe you want to get certified as a peer support specialist, or maybe, you want to do that kind of work that is much more on the ground. Maybe your lane is organizing protests or, doing community organizing against some of the horrible things that are happening right now that are impacting folks' mental health. Maybe your lane is learning how to write legislation or going up to the state legislature or going to Capitol Hill with your ideas for what needs to be different. Maybe it's just staying informed and staying in the loop and actually knowing what is a piece of legislation in your state legislature, unlike me. But yeah, I think there's so many ways that people can be engaged and make a contribution. And we all have mental health, like I said. This is something that belongs to all of us. So just find your place and lean in.
Well, thank you so much for your time. It was really great to get to know you and learn more about your work and your impact on youth mental health and all that you do for it. And we're really excited to see what you continue to do in your job and professionally.
Thanks
Thank you
so
so
much for
much.
having me. And I
Thank
really
you.
appreciate getting to connect with you all and look forward to staying in collaboration.